continuing with the stage of reflex activity. The reflex activity begins to return. We know that after the stage of spinal shock, there is a return to that. Now, the flexor, what we have to remember here is the flexor reflexes, they return first. So we know that there is paraplegia in flexion. That means the person is still having the paralysis of the lower limb below the level of lesion, but his flexor reflex is slowly, the limbs are getting flexed. And to elicit a flexor reflex, a painful stimulus might be required. We know that whenever we give a painful stimulus or noxious stimulus, withdrawal is the first sign. And withdrawal means there is flexion involved. So another thing is that that's one sign that there may be withdrawal of the limb, that is the flexion reflex is back. Then the first reflex which usually appears in such cases, Babinski sign. So now it is showing me upper motor neuron lesion type of sign where the Babinski sign is positive. Followed by your flexor reflex return, the extensor reflexes also return back, but maybe after a variable period. Means if this has returned in a 3 to 4 weeks after the injury, this may be during, the 5th to 6th week of injury. Initially, what is the first thing that comes? That's the knee jerk, which appears, followed by the ankle jerk, which may come on later on. Coming to something which is important for to know is the mass reflex. During this stage of reflex recovery, I can say when we are walking towards a recovery path, there is something called as mass reflex. What do I mean by mass reflex? Mass reflex, it can be elicited when we scratch the skin over the lower limb or the anterior abdominal muscle wall. Okay, depending on where the lesion is. Now, what do I find is, suppose if this is the person I'm talking about and he has a lesion, if he has a lesion here, we know it will be tetraplegia. If the lesion is over here, it will be paraplegia. If I scratch the abdominal part, if I scratch the screen area or the lower extremity, the part of these, the lower extremity, there will be a series of reflexes. There will be, it will be characterized by a series of reflexes. What are those? There will be first the spasm of the flexor muscles of both the limbs. There may be evacuation of the bladder, so the person micturates, and there is third, the profuse sweating below the level of lesion. Since it is very important with the point of examination for UGs, let us try again. First of all, you should know where exactly do we find this mass reflex. Mass reflex is seen in the second stage of spinal cord transection, followed by the spinal shock. Once after the spinal shock period is over, you are on a path of recovery. We find that if I scratch any part of the skin, maybe the upper abdominal skin, or maybe, inner part of the thigh, there is a mass reflex means there are many reflexes which follow on to this. And what do I find? So mild noxious stimulus has to be of little increased intensity. Hence, we are using not a mild touch or pressure stimuli, rather we are using a noxious stimulus. So it is going to cause the withdrawal. So we know the first reflex to come back after the spinal cord transection is the flexor reflex. So withdrawal reflex is the first one to appear. Hence, when you are given a noxious stimulus, there will be withdrawal, flexion. Withdrawal means flexion. And the next thing that we find is there may be defecation, micturition. And there is a profuse sweating below the level of lesion. There is one advantage in these patients is if you want to elicit the micturition reflex or the defecation reflex in such patients, you can try to elicit the mass reflexes. So it is important when you're trying to elicit voiding means you're trying to elicit the micturition and the defecation. Okay. Control of micturition and defecation slowly is now going to improve on. Initially, we had the urinary retention, since there was loss of all the sensations from the lower back, all the reflexes were lost. There was a stage of areflexia. There was no local reflex still present. So such people in a state of spinal shock, there was retention of the urine. But when you are going towards the recovery, what is happening? There will be slowly the local reflexes will try to appear. And hence, whenever there is stretching of the urinary bladder muscles, there is a reflex which causes the evacuation of the urine.